Welcome to VNA Health Highlights, a program of the Visiting Nurse Association of Cape Cod. I'm Jeanne Sarnosky, and on today's program we're going to learn a little bit more about our Public Health and Wellness Department, and they'll be talking more specifically about a new chronic disease management program, My Life, My Health. So we're lucky enough to have with us today two of the people from our department, and it's Kathy Berry, thank you for being here, and Kathy Ganey. I appreciate your time.
Hi, Jeanne.
So always for the viewers, I like to try to introduce you and give them a sense of who you are. How long have you been with the agency? So Kathy, I'll start with you.
20 years.
20 years?
Yep.
Wow.
Yep. Long time.
How did you get into it? Do you remember?
Yeah, I started as a home health aide, and I've just always kind of kept moving a little bit with different hours and different jobs. There's always postings, so it's really good. It's worked out really well for me.
Yeah.
Yeah.
And you like the department that you're in now?
Yeah, public health. It's really interesting, and I'm learning a lot. I've been in the position, I think, 3 years.
Oh, yeah.
Yeah, it's great.
Nice.
Great.
Good. And what about you?
I'm with the agency, it'll be 5 years this year.
Oh, yeah.
And I came to Public Health and Wellness, and that's where I'll stay and leave.
Have you both been on the Cape for that kind of period of time, or?
Oh, I've been since '87.
Oh, all right.
Time.
So you're
Kids
very
went through
familiar with
school.
the communities. Yep.
I only moved here in 2005.
So about the same amount of time, just, well, a little bit more.
Yeah, I did fooled around a few different things before I came back to my roots.
Oh,
in
yeah,
public
very
health.
good. Public health, that's your
Yes,
roots? Yeah,
yes.
very good. Now, you have various and different duties within the Public Health and Wellness Department of the VNA. Can you talk about that a little bit, just to give people an idea of what you do?
My job is the Public Health Contracts Coordinator, and what that is we are the town nurse for most of the Cape towns. I'd say 13 of the 15 Cape towns, we're the public health nurse. So that involves a specific contract with each town, and we do health fairs, blood pressure clinics, flu clinics, child immunizations, all kinds of stuff. Anything that the public health needs, and towns are a little bit different, so we kind of go to the towns and say, what is it that you feel your community needs? And we really work right around that, and you know, so far it's worked out great.
Right. So once upon a time, every town had their own town nurse, and then budget restrictions or whatever reorganization, it was wiser to subcontract with somebody like the VNA because we're all set with that.
Definitely, and I think because we're affiliated with the hospitals and we have the VNA certified, and it just makes it really kind of a seamless interaction. So it's great, works out really good.
And much more support for the towns to have access to all those.
And the towns really like it, and our manager has a close relationship with the towns, and they know her, so it's really good with the reputation that the VNA has and the reputation Mary has too.
Yeah, great.
Yeah.
And what about you, Kathy? You're into something different.
Well, yes. Well, I'm the actual nursing end of it. I'm actually your town nurse. And we have, we're a small but busy department. There are 2 full-time town nurses, 2 full-time RNs, public health nurses. And we sort of split the Cape in half. My coworker will say we'll split it in half with Barnstable, goes from Barnstable to P-Town. I go from Barnstable up to as far as Plimpton. Up to and including Plimpton.
Wow.
Which we just recently acquired that contract with them. And we do what every town, as anyone who's lived on Cape Cod knows, the needs are different with every town.
Right.
So we try to make a program tailored to fit every town we're in. I mean, I'm in Mashpee and Falmouth, both those towns, besides a few others, for example, and the program is different in each town, what I do. So we tweak it according to the needs, according to what the contract allows, and we go from there.
So just as an example, what kind of, if a viewer would see you, maybe you've come through their front door, what would you be doing?
Okay, so being the town nurse, I like to identify myself as that. It's because hopefully I'm going to be the resource person. Public health means wellness and prevention, and that's really what we're out there to teach. To pass on. I would, it ranges. We do immunizations in all the towns. We do the communicable disease surveillance, which any communicable disease, including the tick-borne diseases, which are pretty prevalent on the Cape, come to me by way of a computer system. It's called the MAVEN program. And I have to follow up on all these cases to hopefully see how the person's doing, particularly if it's something like an E. coli or something, to make sure it's not in any of our restaurants, in our towns, or anything, or the water. Pertussis has been coming back. TB is coming back.
TB, I saw that in the paper.
Yes.
So that cases like that,
we are
all
the
over
public
that.
health department that is in on that TB case. Not me personally, because Yarmouth's not my district, but yes. When people talk about the nurses that come, it's the VNA of Cape Cod. We're the public health nurses in an incident like that.
That's great. I don't know that all viewers would know that.
I don't think they do.
Yeah, so that's good to know. Yeah.
A lot of, matter of fact, a lot of the patients that I see, they can't, it's very hard for them to understand the correlation, because when I say I'm the town nurse, but you're with the VNA, and they just think VNA is when they've been sick and had the visiting nurse. So it's really, I've been really trying to teach the part of public health to these people, what it does.
That's a big agency, and we actually do both things.
Right.
Yeah.
And prevention, especially in today's day and age with all the changes in healthcare, it's going to be very important.
Right. So on that note, that's a perfect opening for, I know there's a new program, My Life, My Health, and I'm just going to hand it over and have you talk about it, because it's all about that wellness, right?
Yeah, well, we both took the course. What was it? A 4-day course that we took, and it's basically from a Stanford evidence-based program that was started in Stanford University in California, and it has to do with chronic disease, how you manage your chronic disease, and sort of like a self-help. It just teaches you better ways to manage it and things you can do, you know, to improve your own health. And it just seems like it would be something really good to offer the public. So we all were trained, like I said, took a 4-day course, and we're hoping to kick off our first program February 4th, I think, is our first scheduled one. And we're hoping to get the public involved. It's free. It's a 6-week program, and I believe we're doing it 5:30 to 8. 6 weeks starting February 4th, and it's just another good wellness program. So hopefully.
So you both went to become trained to be facilitators of this program.
About 7 of us from public health were trained in the program. Mary wants to have it constantly involving. We'd like to have it involving throughout the towns once we get our
off the ground.
And Kathy and I are actually going to be the initiators. So
first one.
We're hoping, and it's really just a coping tool. We're not going in there to, can't fix chronic disease per se, but we're hoping to give people the tools to cope with it.
So
and
I'm going to back up just a little bit, because we talk about even chronic disease, and for viewers who may not understand some examples maybe of chronic disease and what people might be dealing with those, if you could like
Sure. Well, the most obvious are, you know, diabetes. Just about everybody knows diabetes. Arthritis. Chronic lung disease. People don't think of depression. That's also a chronic illness. Having a blank, Kathy.
No, that's good.
Well, she mentioned arthritis, and that was one of the reasons I took it, because I do have rheumatoid arthritis, and I'm always kind of looking for things. So I thought, why not? You know, it's just another tool for me. So
I would think that would help as a facilitator to have your own personal experience. When you're giving it back to the classes like that.
Most of the
participants.
Most of the leaders have they themselves have a chronic issue.
Is that right?
It's helping cope.
Or they care for someone with a chronic issue.
So they have very much firsthand experience in what it's like to be dealing with these diseases. So what will the class offer for people like this?
I hope that it gives you the power to really take care of your own health, to do as much as you can for your own health. I mean, when I took the course, it's almost life skills, managing your time better, you know, acknowledging your disease and trying to work as well as you can with it. You know your limitations, you kind of set goals, but to set practical goals, and it's just really, I think, life skills.
Yes, and it's not one chronic disease. We don't invite
so it's not a class.
All the people with the
right.
So it's not
disease.
like one of them's arthritis and one of them's diabetes. So it's a mixture.
It's a mixture
of any of these, people with any of these issues could all be part of the same class.
Absolutely, we're hoping to give them the tools to be able to cope and manage it well.
Right.
You know.
So what kind of what would be the biggest challenges for people with those? Is it nutrition or exercise or all those things?
Well, all of the above, but we also on the Cape have a lot of shut-ins.
Okay.
And people that just aren't motivated or don't know how to get out and about to be with people. And hopefully there's a twofold thing. They'll learn about to better manage their illness, realize there are other people that have issues.
Like
and
me out there.
Maybe be able to, really see it as something they can tackle instead of something that they just have to live with.
Yeah.
Meaning may not be pleasant, but they can make, the best choices to make it a more pleasant, a more desirable situation for them.
So it's more of a improve their quality of life, maybe.
When we took the course, one of the things I noticed was that we all you'd say out loud, kind of why you're there. And we all basically talked about the same thing, regardless of what chronic illness you had. So I think it sort of intertwines.
Like what? What did you talk about?
I get frustrated because when it rains, I ache more.
Oh, okay.
Or I can't walk as far, run as far. So it teaches you, set a goal and work to that goal, where I think I can't do that. I'm not going to do it. But if you set that little goal, and it was kind of refreshing to hear everybody could relate to everybody else's.
Really?
Yeah. So I think it makes you, like Kathy said, you're not alone. And sometimes that in itself gives you a lot of power.
Support.
Yeah.
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 So is the class structured kind of that way to make, to do the little goal settings?
Yeah, you try to do, get people to do what they want. If you don't want to say a word, you don't have to say a word.
Okay.
But they do try to encourage everybody to talk, and what's been your most difficult obstacle, things like that.
Yeah.
And then it's almost like they give you the opportunity to let the audience troubleshoot for you if you want them to.
Oh, good idea.
Yeah.
So it's very supportive.
Absolutely.
Within the group.
Right. Right.
So I think people will also find that maybe persons at home don't understand what they're saying, but someone else that has an issue, they might be able to say, that's just what I'm feeling. Well, I do this, and come up with good ideas, well, this works for me when I'm having a bad day or when the pain sets in or something else. And I think sometimes it's much better to come from someone else than a doctor or your family member, because we're not always in the right frame of mind to give that advice. So it hopefully we're going to be successful. We definitely
so a sharing
look forward to it. Absolutely.
People like me. Yeah.
And the evidence-based part of it, I mean, it's a proven program. So it's sort of like a win-win, really,
So what's the outcome then? What's the hopeful outcome for the people that attend the class?
That you take the tools and use them on your own.
Right.
All right. And there's a workbook? Did I hear there was a?
Oh yeah, great book.
Yes.
Yeah,
and all the people that go to the class get one of those?
And get a notebook to follow through,
Okay.
Yeah.
Then what happens after the class is over? Can they still tap into the next class or call back for support, or is the hope that they'll make connections within the group so you can?
Well, they will be given the tools and they will be given the information they need to go on. And absolutely, being the VNA like we are, we always have people calling us back. So that's never an issue. There's always going to be someone that can hopefully answer their question.
Oh, good.
Or at least point them to where they need to go.
Yeah. Right. So who can participate in the program? Are there any restrictions or?
No, not at all. And
age?
Nope. Income? Nope.
That's why we kind of offered
it
at night to get, hopefully people my age, after work, and not too late where some seniors can still get out. So hopefully, I think we'll do good.
Yeah. So this is the first program. This offering, this 6-week program is the first time we're trying it.
The first time the VNA is trying it.
And so going forward, it'll be offered again, or it can be...
We plan, like Mary, 7 of us have been trained, so we plan it to be a continuum.
Okay.
You know, different towns, different locations. Right now we'll be doing it in Dennis, but we plan to, you know, go over to Bourne, go out to P-Town. We plan to extend it.
Just because I know this show broadcasts from P-Town to Plymouth, so if any of the viewers say that sounds like a fabulous thing that we could offer at our senior center or whatever,
absolutely,
they can contact you and something like that could happen.
Absolutely.
Definitely.
Good. No fee?
No fee.
No fee.
All right. So
everybody loves that.
Yeah. Free is always better.
Yep.
Yep. And they just need to call to find out more, to register. Okay. Anything else about this particular program that we haven't touched on before I get into?
No, I think that's it.
That's a biggie. It sounds like it'll be great.
You might want to speak to us again in 6 months after we've done it.
Right.
You know what would be fun is we could even have someone, if they were willing, that participated in the program, because then you really get the story from someone who benefited and shared within the program. Yeah. All right. Now on to, and we touched on it just a little bit, but the Public Health and Wellness Department of the VNA is such a big piece of what we do. I wonder if everyone knows, like you had mentioned, Kathy, you had mentioned, when I'm in someone's home, they don't get that I am the public health nurse, even though
even at a blood pressure clinic,
VNA.
they don't understand it. Yes.
Yeah. So, as part of the Public Health and Wellness Department, was there any particular special training in public health that you both needed to, you know, get into that field? Or?
Well, I'm a nurse longer than I care to say, but I've been doing public health about 15 years.
Okay.
And when I came to work for the VNA in the public health department, I took a Massachusetts Department of Public Health course, which was well over 3 months, and it was in the fundamentals of public health. It was quite intensive. It was excellent. I've taken a NIMS course, which is National Incident Management, which is if I get alerts from the state on a regular basis if something is going on, like any kind of catastrophic thing,
like,
you know, when the hurricanes are coming.
Oh, okay.
Or you know, the bad snowstorms, or a few times even with when they weren't sure of what was going on in Pilgrim in the
nuclear
plant. Yeah.
Yes. So we're prepared to hopefully respond to any, hopefully we'll never have, catastrophic incident. Also, public health is very ongoing. I mean, my coworker and I just took a course on hepatitis up in Boston about 2 months ago. I've taken many courses. Right now I can't even think, but it's always evolving. TB is
the biggie right
here.
Now. Yeah.
And I work very closely with the Massachusetts TB department, and they're a powerhouse of information. I work closely with our IDCS, which is Infectious Diseases Clinical Services, which is in Cape Cod Hospital, Falmouth Hospital.
Oh, good.
Whenever we have a TB patient. And we work very closely together. I mean, it could be at least a weekly call, if not daily, if we have one of these cases. So it is always changing. It is always, and with the pertussis, I've been dealing with the immunization nurse about the pertussis cases. So public health is always evolving, and we try to stay current, and we really work at it. And Mary is excellent about letting us go to classes and even finding some for us that we may not be aware of. So it's evolving.
So how is public health different than, public health nursing different than just the regular nursing of the agency, would you say?
Well, we zoom in on prevention and wellness. Okay. And prevention is the key. You know, teach people to get their immunizations, their flu, their pneumonia when necessary, the shingles vaccine. So we really try on prevention, you know, fall prevention. We do a lot of teaching of fall prevention in the homes. You know, just silly things like tying your, maybe I think it's silly, but people may not think of, you know, making sure that either the rug is definitely secured or not there at all.
Gone, yeah.
You know, and just little really everyday things, but it all revolves around prevention and how to keep their pills and when to take their pills and where they should be and where they shouldn't be in the home and things like that. So it's changed.
And the patients you see are through certified. That's that
Right.
whole unmet need,
Yes.
the patients that she sees.
Mostly our contracts right now have been dealing, a bulk of them, not the whole thing, with the senior population. So the people that I see in their home are not people that would qualify under Medicare for any kind of service, but it doesn't mean they don't have a need.
So they're still at
They
risk
need
in
coaching.
some way.
They
or
need
help.
coaching. They need to be taught why they have to take their pill, why the oxygen should or shouldn't be on. You know, different things, what they should use, you know, to keep themselves nutritionally healthy. You know, different ideas in sleeping. If they sleep better, they will hopefully feel better, and maybe that'll avoid them having a fall. So it all comes together in one way or the other. I mean,
So do you have a list of resources available to you to connect people to? I made me think of it was nutrition. So you
Sure.
may get into a home with someone
and
that
I have
could use a
called
little
on-
help.
VNA has a nutritionist, dietitian, registered dietitian.
Or if they had Meals on Wheels or something like that.
we call in all this community services.
Okay, talk
Actually, we
about-
work
yeah.
very close with the Council on Aging's,
Okay.
the senior centers,
Yep.
and we work with the outreach worker in each town.
Oh, okay.
And that's mainly where we get our referrals.
That was my next question:
Yes.
is how does someone come to you in the first place? How do you?
We get
them?
our referrals to them largely because people come to the senior center, either a woman or a gentleman is telling somebody about their neighbor or their wife,
Oh, yeah.
and that's how we get the referrals. And sometimes it's just as simple as a look-see for me. I'll go in and I'll say, "Oh, this person needs certified,"
Right.
and put them right onto certified. And or they may just need PT because I'm.
And when we
noticing
say
they can't.
certified, that's
the VNA
services covered by insurance.
Medicare, or insurance. Yes.
Okay. Okay.
Well, I'm talking seniors, so that's why I'm thinking.
Yeah,
Medicare.
yeah, yeah. Just for, I'm trying to think
Yes.
of how people understand how things happen. So you're a direct connection to all the senior centers that are out there.
Yes,
So you have a
yes.
good relationship in your
Yes.
geographic area with that group. All right. Now, public health contracts coordinator. Then Kathy, you work with all the different towns?
Yes.
Okay.
A lot of the health agents, a lot of the senior centers too, because a lot of our health fairs are at the senior center. So we coordinate that and what the town needs. You know, we do bone density screenings, blood pressure. I mean, really everybody can go CVS for blood pressure, fire department. So we kind of try to, what is it that you're missing that we could do? And nutrition series we started, which the towns really like. Diabetes seminars we do, because there's a diabetes educator on board at the VNA. Bone density, we've done walking programs, bike programs. What else?
Ask the Nurse program.
The Ask a Nurse program.
What is that one? What's the Ask a Nurse?
It's basically the nurses at the senior center, a set hour once a month, and people just come in and ask if there's any kind of question, and she's actually getting good feedback of what they want. And then it turns into, well, I don't know about shingles. Can you guys come explain that? And she'll do that. Or I'm not sure of what services the VNA has. Could somebody come in and talk to us? And we arrange that. So that's what the Ask a Nurse is. So yeah, it's all different programs that are kind of geared to the towns. Like Kathy said, with town nursing visits, some towns have the nurse go out to see patients that are kind of, I guess, unmet needs, fall between the cracks.
Yeah.
Some towns don't have that, but they, you know, their monies go to a different venue, I guess, is how I would work it.
Yeah.
Yeah.
So right now, the towns, you know, as we alluded to at the beginning of the program, once upon a time, every town had their own town nurse, maybe more than one, to cover all the needs that were out there. But then as things have changed, they now contract with us. So then that happens once a year. You meet individually with the powers that be at the towns.
Right.
Develop a plan for the upcoming year of what kind of services are needed in that town because they know their population.
Right.
And then is there anything we don't do, or we kind of go with whatever they
We really
need?
go with what they need. I mean, even the town of Brewster, it started with the town nursing because they found that, gee, we need some kind of, you know, we need patients that are falling through the cracks. Is there anything you can do? And then that's how we started doing that in the town of Brewster. So you really go with what the town needs, which is really nice because, I mean, there's a lot of different options out there. The VNA is a big group as a whole, but sometimes we miss the little pieces, and each town knows. So we definitely wrap their contract around their town.
Their needs,
yes.
They'll fit whatever. And you have a whole fleet of nurses and other
per
staff.
diem nurses, when we do flu clinics, there's a lot of nurses.
That fill that need that's out there. So
And
when
the
people
towns
maybe are
love it.
watching the show, you may like, you two just do all that.
Right.
No. You have a whole group of people that you tap into, so that when viewers maybe go to their town flu clinic, it's really the VNA that's giving them the flu shots.
Oh, definitely.
And that's good for people to know, I think. Yeah.
And you reminded me too, because maternal child health is a big part of our of what we do too. And we have 3 maternal child health nurses that go out to first-time mom for that, you know, just that first visit, because a lot of times insurance won't pay for that.
Right.
So we do
to
that.
make sure
And a lot
everything's
of the
going
towns,
okay.
If the baby's underweight or if there's a health issue. So that's a really nice piece that we do too.
Our 2 adult daycares,
Yeah.
Oh, yeah.
which
another
are
part.
excellent. We also are, we're the overseer of the children's daycare over in Falmouth.
Right.
And we have regularly scheduled immunization clinics for both children and adults in
At all
both Dennis
locations.
and Falmouth.
Very good.
And we will take our bag and go wherever we're needed. So
That's good
for
to know.
clinics.
So believe it or not, we only have about a minute left, so I just want to be sure, is there anything that we quickly didn't touch on that, I got to make sure people know, have we covered it?
Well, we're there, and just call and ask.
Good.
Yeah.
All right, very good. And then when people see nurses out in the community, more than likely it's a VNA nurse that's helping.
That's right.
All right, very good.
VNA of Cape Cod, ask for us by name.
Ask for us by name. Good job. Well, thank you so much, both, for being here. I appreciate it. Good job. All right. And I'm Jeanne Sarnosky, wishing you good health and good health care.